Rahim. My dear vascular colleague, I would like to speak today in the series of Mastering Vascular Surgery about the superficial vein thrombosis algorithm according to the recent guidelines. My name is Mr. Muhammad Omar Farouk, consultant vascular surgeon. As I have mentioned, one of the very important mobile application for vascular guideline is European Society of Vascular Surgery mobile app. This is very powerful mobile app, and we have discussed how the guidelines is all written, the recent 10 guidelines over the last couple of years, and the recommendation as well if you want to get summary. But here I will present another facility which, if you are in an outpatient clinic and you have a patient with superficial thrombophlebitis, it's a very good idea to open the application on a tool which is called the Algorithm tool. The Algorithm tool, which I will show over the next slide, will help you to make the decision, to have the evidence of this decision, and maybe to read also a little bit about it. So let us discuss treatment of superficial venous thrombosis algorithm. So here is the application, and as you can see, the guidelines are on the first section, the second section is tools, and the third section is recommendation. So we'll go to the second section, which is tools. If you go to tools and you go down, there is multiple tool. We discuss the tool for superficial venous thrombosis, which is this one. If you press on it, you will get this screen. This screen will tell you that the first thing you need to do is to ask for a whole leg ultrasound scan to confirm that there is no DVT, associated deep venous thrombosis. And this, the class of recommendation is 1B. So this is very strong recommendation. And you will have one of two options, either superficial thrombophlebitis or superficial thrombophlebitis according with DVT. The one according with DVT will be managed as DVT. So let us see the superficial thrombophlebitis. If you press on superficial thrombophlebitis, you will get the category of, is it less than 3 centimeters away from the junction with the deep vein or extending more than 5 centimeters, or it is less than 3 centimeters and away from the junction. So one option will be little bit dangerous, superficial thrombophlebitis. One is less dangerous. So you need to classify into these two categories. Let us say the commonly one that we see, which is the one which is more dangerous. Let us see what you will do. You just press and click on it, and you will have all the recommendation available for you. The color coding is very important. Green when you have a class 1 recommendation. If you have a class 2, A and B, it will be in blue and orange. And the red one is class C, which is not to do. So number option is fondaparinux 2.5 once daily is recommended, and this is 1B. Or you can give an intermediate dose of low molecular weight heparin, and this is 2AB. A 45-day course of anticoagulation is recommended, class 1B, and 3 months course of anticoagulation, which is 2B, strength of evidence is C. Ablation of anticoagulation superficial veins should be considered once acute inflammatory and post-thrombotic phase has settled down. So there is no rule for antibiotics. There is no rule for anti-inflammatory. This is the guideline, and this is the best evidence that we have in surgery. It will solve you a lot. And once you use this algorithm 10, 20, 30 times, it will become a natural habit what to do, and probably you don't need to open the application anymore. So let us continue by having the less dangerous one, which is the other option. And here, therapeutic anticoagulation is recommended, and this is class 1 evidence C. And 3 months anticoagulation is also advisable. As you can see here, if you have a patient with DVT, you need to go to another algorithm, which is DVT. Now, the beauty of this application, not only that, but you can have more information, and you can reset it. If you are in the middle with a patient, you can reset, so start for another patient. But the most important one is more information, because here it will give you why it have shown this algorithm. And there is, as you can see, there is a protocol for superficial thrombophlebitis with the recent ESBS guideline, which is, you can straight away look at it. So this is the less dangerous one. And here is the recommendation related to your option. As you can see here, here is the flow chart. You can have number 1 to do duplex scan, and you have either less dangerous or more dangerous superficial thrombophlebitis. And this is the algorithm which exactly has been implemented in this patient. You can review it, you can see the evidence, you can read it, you can thoroughly look at it and see which pathway the patient will go through. It's extremely helpful. This is figure number 11, flow chart, and it's very, very helpful. I hope with this example of how you can manage patient with superficial thrombophlebitis, you can tune your clinical decision making to be accurate, to be standard, and to be recent, and to have an evidence why you have given this type of treatment. I will go through multiple of these tools, hoping that if you apply it 20 or 30 times, it become natural for you to do this algorithm. I wish you all the best. I hope this presentation is of benefit to you. With all my best regard, Dr. Muhammad Amr Al-Farah.